So welcome, George.
Good morning, guys. Or should I say just good morning or hello?
That's the intro, right?
No,
you went ahead and started.
No.
You say you got the intro. Well, I mean, you created
Nah.
the podcast as a whole.
I did like the
you
first
got the intro.
6. I think I did the intro so I told Terrence for the latter half of the season, I'm just let him do
Let
the
him
rest
do it,
of
huh?
No, but I
let him
say
do the rest
I
of
say
it.
we keep what we just did. Like keep that. It's,
Yeah.
Public health isn't always official. We're not
Yeah.
always suit and tie, even though each of us are wearing a suit and a tie.
I took my coat off for this, so you guys will make me sweat. So this is the first time I've ever I've never done a podcast before. So this is kind of I'm used to standing in front of the media with a microphone or a TV camera. Never done a podcast.
Yeah.
So this is a new medium for me. So this is my virgin voyage here.
Yeah.
Everybody does a podcast every day in the confines of your home with your family. You just don't have a microphone in front of you as you
That's
talk.
true.
It's just natural conversation, natural dialogue. But for everybody, this is our 10th episode of Casting the Net, the official podcast for the Northeast Texas Public Health District. We did intentionally reserve our CEO for later in our season. Tradition as usual, when you start any kind of media product, you want to have your director, owner, manager, CEO, executive director. They're the first episode. That's almost like the standard expected protocol. But we wanted to shine the light on each of our departments individually for our first season. And then we're putting a bow on this first season. And this is somewhat of a soft intro for season 2 that's going to start in 2025 by having George T. Roberts Jr. To give an overview of what used to be the Smith County Health Unit.
Right, goes back to the Tyler Smith County Health Unit.
And this goes back to what is currently the Tyler Recycling Center. That was the first actual office of what is now the health department for Tyler and Smith County, way back in 1936. Ooh. Or 1936. You got to add the word "and"
before we all came on the premises here.
Before any of us were ever a thought. This was back in 1936 when that began, and then this was in the mid-'90s when you had absorbed other services.
Well,
other
it became, I guess it became, there was a law, the Health and Safety Code of Texas was amended to allow for 2 governmental entities to come together and form a health district. And so in the early 90s, I think became effective in 1994, that the city of Tyler and Smith County came together and formed, at that point, an entity known as the Smith County Public Health District. And so 30-plus years ago, as a matter of fact, our current attorney, Sharon Roberts, was the one who actually wrote the documents for this.
Oh, wow.
So it's a very unique type of organization for a, quote, health department, because it's kind of hard. Different thing about podcasts is you can't see me use my hands. Got to talk my hands.
Y'all imagine?
Yeah, I'm talking my hands here. So, but the health district was formed at that point, and then so basically the city of Tyler and Smith County were like, we need to figure out a way to set up the health department, now health district, in a way for success. And at that point, we had a number of clinical services. And we had, everything from we were doing prenatal care, we had a primary care clinic, we had a pediatric clinic, we had a HIV and STD clinic, and so we were doing lots of clinical type services. So when I joined the health district in 2006, we had a full clinical piece, and we had the public health services. And when I first joined, we were trying to establish the clinical piece as what's called a federally qualified health center, or an FQHC. Mm-hmm. And so one of the first directives that the board gave me, this is now 18 years ago, said, hey, we want you to get this our clinical piece formally set up as an FQHC. And so we were able to do that, and that became effective September of 2007. You know, the difficulty in all that is that to become an FQHC, you had to set up a 501c3 nonprofit to house the FQHC. So when I came on board here, there was a board for the clinic. The FQHC at that time is called Community Health Clinics in Northeast Texas, and had a board for the Northeast Texas Public Health District. So I had two different boards, but one checking account between us. So it's kind of interesting dynamics of governance between the two. Well, fast forward, once the clinic became an FQHC, they wanted to become more and more independent. So we did a business separation with that organization back in effective October 1 of 2008. And so we kept the health district, and we were able to move on from that. So it took a lot of my time for really the first couple of years dealing with the clinical pieces of it, because it was a kind of a challenging time. But then they moved forward, and we moved ahead as the public health district with public health services lacking clinical services.
And so the FQHC that was known then as Community Health Centers
it's called the Community Health Clinic in Northeast
Texas.
And then they changed their name to Total Health Care. Well, they ended up, several years later, they ended up dissolving, and then the Tyler Family Circle of Care essentially absorbed. They didn't take it over, but they essentially absorbed it is what happened.
So that highlights many community partnerships that Net Health has created, developed, maintained, has cultivated and fertilized over the years, since 2006, since you started. But I've made this comment in previous podcasts that there's a distinction between what is a health district and what is a health department. Now, you touched on that a little bit earlier through the cooperative agreement of why we're not the Northeast Texas Public Health Department, we're the Northeast Texas Public Health District. So if you could touch on some of the differences even in other counties and other cities in Texas of how there are health departments versus how there are health districts.
Yeah, typically a health department works underneath a city or county, a local health department works under a city or county governmental agency. And when the city of Tyler and Smith County formed us, they essentially were wanting to separate us out into our own entity, our own corporation per se. Mm-hmm. And that's what we were able to do here, is that basically while the city of Tyler and Smith County obviously has influence over us, they appoint a couple of board members. They do not really work. They aren't really part of our day-to-day operation. And it's a neat form of governance, because the city and the county have been very good to us. They have helped us. They've supported us financially over the years, but they've also allowed us the independence to do what we need to do. So we have a 9-person board here, and so I report to a board. When I was appointed, I had to be approved by both the city and the county. So they had to approve my hiring as the CEO, but essentially most people in my job work for city county government, but a health district, and I think that gives us more flexibility how we want to operate things. Mm-hmm. So, we've been able to expand all over East Texas with our particularly WIC and preparedness and things like that. So I think it's really a unique form of governance for a health district, and we're incentivized basically to operate efficiently and effectively, but also serve our communities.
So by default, we're the health department for Smith County.
Correct.
But operationally, we are a separate entity. We're
Correct.
Our own company, our own business, it can be different because I'll receive calls and emails from individuals that may have moved from another city or from another county, even moved from a different state, and you say, "How do I get in touch with the health department?" It's like, "Well, you're talking to
you've reached us. We're here."
Depending on which city or county you may live in, because Net Health, there are some services that are focused just for Smith County.
Right.
If you're a city or an unincorporated community within Smith County, which is Bullard, White House, Lindale, Troop, Arp, Winona, Noonday. If you're physically within the county line of Smith County, some of our departments are particular just for those businesses, just for residents in that county. Now, we have other services that are open to East Texan residents regardless of what county you live in. So that associates with our overall name, us being the Northeast Texas Public Health District. If you live or work outside of Smith County, we can still provide services for you. If we can't, we can connect you with the appropriate organization in that city or county that you live in. So
Yeah, we like to say that we have programs and services in 21 East Texas counties. So we operate the WIC clinics in 20 counties, and we have the contract to do that with the state, and we also provide public health emergency preparedness and disease surveillance in 7 counties in East Texas. So we have a very wide geographic swath that we work with, and I think it's really worked. I think one of the best things that we have is we have over 150 employees that work for Net Health, and we've got a very passionate group of employees that basically are here to serve individuals and communities day in and day out. So it's a really neat organization.
And speaking as an employee of your organization, we're only able to do that because of your personality, George. Flashing back, y'all, to the movie Remember the Titans. There's a scene where attitude reflects leadership.
Yeah, that's.
I'm not going to come over to you and push on you and say strong side, left side, strong. But how or why or when did you make the decision that you wanted to get into public health?
Sure, that's a long question.
Well,
so
that's the beauty of a podcast.
Yeah,
George.
take us back.
So
Take us back.
So basically, I started out. I wanted to be a doctor in college, and decided that really what I liked was maybe perhaps the business side of healthcare, not necessarily the detailed physician type of work that I would have to go through in med school. So I made the decision, I guess it was junior, senior of college, to basically go into health administration. At that point, people in health administration or hospital administration, you didn't have, that wasn't one of those careers that people just sat up and woke up and said, I want to be a hospital administrator today. But I got into that, and my middle brother's fraternity little brother in college had done the same thing. He had started off wanting to be pre-med, and then he got into health administration. And this particular gentleman ended up, so I went back and after I graduated from SMU, I went back to Memphis, Tennessee for a year and worked at Baptist Hospital, which is at that point was a 1,900-bed nonprofit hospital, the largest private hospital in the country.
Wow.
Great organization, and probably stories for another time. Basically, the year before I went there, Elvis had been brought in DOA the year before. So very interesting stories that went around of Elvis there.
So you were present at that. That sounds like a Forrest Gump memory.
Yeah, that was
like a landmark moment.
There's lots of stories. I wasn't present when it happened, but I was present a year later. But the stories were
it lingered.
The stories were very fresh on people's very fresh on people's minds. So I worked for them. I was a methods analyst, and I worked on various projects for administration. So this again, this gentleman that hired me was very good to me, and they encouraged me to really continue on this the career path to go into hospital administration. So I worked for Baptist a little over a year, and then I went to St. Louis to grad school, Washington University in St. Louis, and went there 2 years. Worked for one summer. I worked for the Tennessee Hospital Association as a consultant, helped them out. So it was an interesting road there, and then graduated and was fortunately offered administrative residency at Baylor University Medical Center in Dallas, which is, I think Baylor's one of the premier hospitals in the country. So it was quite an honor to get a chance to do a residency there. And they had been in the field of doing administrative residencies for many, many years. So there was it wasn't a new program. They had certain tasks that we were, that the residents, you rotated through all the departments, but you also took administrative calls. So you that taught you how to take, how do you make decisions? So it was a very good program. Stayed there for 5 years. And then how I got the Tyler is I got a recruiter called about a job at Mother Francis Hospital here in Tyler. So I went and came over. I was a VP operations at Mother Francis. And then I went over to Henderson, Texas as the hospital CEO because, at that point, you got into hospital administration, you want to be a hospital CEO. So I had a chance to do that for 12 and a half years and kind of hit halftime in my career and said, this is not – I got into healthcare as I wanted to help people. Didn't really know much at all about public health and was kind of exposed to this through there was sheltering operations during Katrina and Rita, and I got exposed to public health during that whole thing. And one thing led to another, and I had the chance to step in the field of public health in November of 2006. And as I tell people, they didn't hire me for my vast public health knowledge. They hired me because basically the organization, quite frankly, was in trouble. We were having the issues with the clinic. Financially, we were not doing very well at all. And they needed somebody to basically get this FQHC over the mark and see if we could set up some operational efficiencies and figure out some new ways to bring new revenue into the organization. So I started here in November of 2006, and it's been a major blessing, trying to basically, because again, if you want to feel where you basically feel like you're helping people, it's public health is it. And it's, what I've learned so much through the staff. They taught me that that public health is a passion. And what's different, I found that in public health, the employees that work in public health are not paid as well as those that work in the hospital, but I obviously people are interested in making a living, but I hear more about the stories about positive experience and the joy that people have of everybody that gets in public health. It's mission driven. You feel like it's a calling, and so that's kind of what I've experienced so far with our employees is that they feel called to do this work, and we saw that during I see that when I'm with the employees during various gatherings. We had recently had a Christmas party. And just seeing the passion that our employees have is just always very uplifting to me. How they basically they're here to serve, and so that's been a real calling to me. So I've seen the whole thing going from hospital management into public health management. It's been fun, and it's been fun to do this to get involved too on a not only a local basis but also on a state and national basis too. Excuse me.
Is it fair to say you mentioned Hurricane Rita and Hurricane Katrina? Is it fair to say that you may not have been exposed to public health or had the opportunity to learn about public health if you did not participate in any of those?
Yeah, the sheltering
events.
Yeah,
any of the activities that was part of that response mechanism.
Yeah, that was my first real exposure to. I knew about public health. I knew about. I'd heard about WIC clinics when I was in Henderson. I'd heard about a lot of. Everybody knew about the food inspectors coming. If I had the hospital cafeteria or the hospital food service, you're always a little make sure that you have things in ship shape when the food and the health inspectors come in. So I had exposure that way, but it was but that was my first real. How does this thing really work?
So that really shifted your trajectory.
Yeah,
for sure.
Yeah. And when I took this job, quite frankly, I thought I'd do it for a couple of years and go back to the hospital. But it's obviously 18 years later, I'm still doing this and have enjoyed it.
Well, there are many, I don't know if simile or metaphor is the right word. You've taken this organization from its infancy, being 18 years old now. It's the common number when kids graduate high school.
Yeah.
I mean, you've led Net Health to graduate.
Yeah,
in a sense, and the various departments that we have within Net Health that provide all the services that we mentioned. If you can touch on those a little bit more, as far as in your 18 years, what are 2 or 3 of the overarching landmark achievements that you felt that Net Health has been able to have on the East Texas community as far as our public health impact?
Sure. Well, I think that
I know that's a very broad and general.
Yeah, it's
where you try to highlight and titrate that down.
I guess one of the some of the things that I think that we've done well around. I think our Fit City Tyler collaboration we started back in 2010 around the whole idea of our communities in all over East Texas were getting the obesity rates were climbing. And the fact that we were able to work with the newspaper and the hospitals and so many community partners to come up with the idea of Fit City Tyler to try to make Tyler a fit city, one step, one bite, one health conscious decision at a time, and how that's morphed into we have a health and wellness expo coming up in January. We do the Lighten Up East Texas effort every year. And I think seeing the early on, I remember hearing conversations with Mark McDaniel, the city manager at the time, talking about how he really saw the growth of people going out to the trails to exercise. And now you hear it's interesting hearing younger people now talk about, you talk about what are some of the things they like to do. They like to go walking. That's a big trend with 20 and 30-year-olds. They like to go walk a lot. Okay, hopefully that's something maybe we've had a little bit of influence in trying to get people to get an active lifestyle and basically
to keep that active lifestyle.
Keep them do
continue
that.
to get older.
So I think I think the Fit City Tyler thing is something I'm very proud of. WIC, when I first started here, we were in 7 counties, and the board at the time was, when I first was hired, they said they challenged me we want to do some things that are more multi-county, and we kind of saw early on that maybe one of the things we could do was we tried environmental health. We tried to take that to another county, and the county judge, quite frankly, we had a couple meetings with them, and it's like, well, they're not interested. That's not going to really.
This may not be the best.
Yeah, that's not going to be it. But I knew that East Texas Medical Center at the time had they were doing WIC in 4 counties, and based on my hospital background, I knew that they really didn't want to do that. That really was not in keeping. I think they had really done it because somebody needed to do it years before. And when I approached them about it, they were very quickly said, yes, we're interested in maybe transferring this over to you, because we had the infrastructure set up at that point to be able to basically we knew how to basically we could actually operate it better, I think, because we had 7 counties. Adding 4 more counties to us would obviously increase our work, but also we had the ability we could get efficiencies out of that. Mm-hmm. So that was successful, and then we were able to, a few years later, the state decided they wanted to divest themselves of the clinics that they were operating in the region, so we picked up 9 more counties at that point. So I think growing WIC from 7 counties to 20 counties is now one of the top 10, if not top 5, largest WIC programs in the state of Texas.
So we've asked this question to Jenny Lassiter and to Cora Smith, who's been on our previous podcast. Can you name all these cities where Net Health has a WIC clinic?
Yeah.
You can? Okay.
Yeah.
You don't have to now. Just kind of put you on the spot.
Because I've been to all of them.
Can you name it alphabetically?
Can't do that.
No.
But that speaks a lot for them to even hand you the additional 9 to be like, obviously, Net Health is doing a good job with this jurisdiction in this area. It's just like for them to kind of put that under your purview. That speaks a lot.
Yeah, we had to bid on it. I mean, we had to basically say we want to do this, and the state had to approve that. The state WIC office had to approve it. But we had been intentional about building up some infrastructure inside WIC. Their admin offices had been in another building. And then about a year or so before, we kind of saw maybe that this might be an opportunity, and so we're able to move them to other admin offices, and that worked out great.
Yeah.
So I'd say growing WIC, and I think probably the third big accomplishment was the third thing pops right in is something that impacted every human being on the planet Earth. It was the COVID-19 pandemic. Yeah. It was a public health crisis, disaster. And our whole community had to come together to work with this, and kind of felt like all of our training kind of came into play there. Like, how do you handle something that none of us in our lifetimes had ever had to handle? And we had shutdowns. We had to work with the community. We had to best communicate. We had to try to find resources.
We'd only read and seen pictures about the Spanish flu in 1918. That was
so we were trying
to reference point we had.
We tried to do our best to how do we do this? How do we communicate with our public and try to keep them calm, try to keep them encouraged, but also take steps when there was no medicine to deal with this. We had we didn't have any PPE. We basically started off with both hands tied behind our back, and we had to try to, work our way through it. And we had no testing, so it was kind of a crazy time. But I think I thought our staff here and I thought our communities really did a pretty darn good job trying to navigate through that in 2020, and then the whole vaccine effort in 2021, where people were just Terrence here was having to manage a sign up. We came up with this idea: why don't we use a platform called Sign Up Genius to get people to register for a shot. We had over 50-something thousand people
on the waiting
list at one point, trying to wait to get their shot, and we had to operate. We had to figure out how to set up a mass vaccination clinic, and we did. We made a few mistakes along the way, but I think we did a lot of good work, and we've given almost. We still do a handful of COVID vaccines now. We've given almost 92,000 vaccines. 92,000. So I think so. That was some of the things that I'm sure that every department has made major growth steps since we've been here.
Yeah. So I celebrated 6 years.
Is it 6?
6 years.
Wow.
Is it 6? Yeah, 6 years. December 3rd.
God, I had brown hair back then.
Don't look at me.
Yeah. No, it's just it was certainly an experience because I was only I think a year and a half in at Net Health when COVID hit. So it was kind of like a very interesting way to kind of dive into the deep end of the pool to kind of see Net Health as a whole.
You did not dive in.
You
weren't even pushed in.
Yeah,
No,
like,
we were already in. You were pulled in.
Yeah.
Pulled into the
like,
deep
here,
end.
help me out, and then you get pulled in.
But it was certainly something to see. Not only Net Health, but just working with the city, to figure this out when we had our what were the meetings called?
Emergency Operations Center.
The Emergency Operations Center.
And just to see everybody in the room, scurry around to play their part.
Because as unfortunate as the pandemic was, for public health departments really all across the world, not just here in Texas or in the U.S., our pandemic response was, in my opinion, the first real opportunity that the general public got to see what a health department actually does. We had way more visibility, way more awareness, phone calls, interactions, not just when we were doing the vaccine clinics. Even there'd be times I would just be shopping at the store with my mask on, but people would recognize. That's one thing about working at a health department, everybody. They all hear. We're on the clock 24/7, even if we're not physically in our office. Just us working at a health department, we'll get questions from family members, from just, you work at a health department. Let me ask you about this and this. That's part of our role as working in public health.
It's fun. It's interesting. People still will come up to me, hey, you helped me. You helped direct me to how to get a vaccine. You helped direct me, gave me some advice during the whole pandemic thing. I didn't quite remember that, but people said they remember it.
They remember it.
Yeah, they remember it. But I remember having fun conversations with people in the grocery store, retail outlets, whatever. I remember having phone calls when I'm going through the grocery store from the state. Hey, can you help us out with this, or this is what we're going to do, or can you do this? Yep, we'll take care of that.
So you didn't, George. You never said no. I'm trying to restock my groceries for my family.
We were all. Everybody was all in. And I think another lesson during the pandemic is that you have to be out in your community. One of the things that I've encouraged, the board has encouraged me, I've encouraged myself, and I've encouraged all of our leadership and our staff is get involved in the community. Because one of the things that really helped us as we started off of our ELCs is everybody knew each other. It wasn't a, hey, Thomas, hey, Terrence, it's nice to meet you. What do you do for a living? What do you do? People knew each other. Mm-hmm. So we walked in with a certain level. So, okay, we know each other now. We have to tackle this major lifetime challenge together. And
let's utilize our skills and the resources that we have individually to pull them together. So that pandemic gave the public the big overview of what public health is. But then even, it's almost 5 years now after it started.
Yeah.
That may not feel like it's been 5 years, Joe.
Well, no, yeah. Well, basically, if I remember, it was New Year's Eve of 2019. I remember reading about the first cases of this virus in China. And kind of like the whole month of January, we were kind of like, is this going to come over to us or not?
We had that first case in San Antonio at the military, the Air Force base, and then, yep, it's here.
I remember talking to, because when I was interning, even before I was hired, I remember talking to, he's no longer part of our EPIs, but Jason Sloas.
Yeah.
I remember asking him, potential scenarios about this kind of stuff, because I was like, who to know better than about these kinds of topics than one of our head epis. And then as it slowly got closer to, kind of the day of the first few cases coming out, I just remember asking him, and I remember his tone changing over the course of those weeks. Like, okay, now it's kind of getting serious. Now it's kind of, and then just kind of seeing just how the conversation changed, as the weeks progressed. It was interesting.
Well, just the stress of what our epidemiologists said they were having to, early in the whole process, if somebody needed to be tested, think about now, if you need a COVID test or any type of test, COVID tests had
now.
to be, the doctors had to call Jason or epidemiologist, and then Jason had to refer that to the state. And a lot of times they had to be referred to the CDC before you could be approved for testing. So it may be several days. So it was a lot of bureaucratic. And, why was that? Well, damn, he tests.
Yeah.
So the ability to test people early on was a
very valued resource.
Yeah.
Just having access to a COVID test in early 2020.
Yeah, I remember
mid 2020.
I mean, people calling me trying to get a test, and then talking to our health authority at the time, and it was a challenge to get people tested.
Yeah,
real challenge. And the test itself wasn't the most pleasant thing in the world either.
But I don't know if you had this perspective, but we were very popular back in April and May and June of 2020.
Well, kind of back to what you're saying is like, I think that obviously it's not something that we wanted to happen, but it's certainly something that I think kind of highlighted some areas that maybe weren't necessarily strengths. And it was like, okay, now we're going through this thing. Internet traffic skyrocketed on NetHealth's website. All of a sudden, spotlights and everything were kind of like, okay, where do we go for information? Mm-hmm. And it really put us in a position where all eyes were on the Northeast Texas Public Health District, for a little while. But I think it was a great opportunity, something that needed to happen,
Oh, yeah.
So it wasn't some kind of pie in the sky, in the ether kind of idea of like, what would we do if this scenario happened? Now we actually have a physical, tangible experience that we've gone through to better prepare us for the next. Because as you always say, Terrence, not if, but when. Because humans have dealt with disease, and that's what we're in the business of. Addressing health issues and health disparities. So not if, but when.
And then we use those learned lessons for future, I won't say what ifs, but there are some inevitabilities.
Yeah.
That's a hard word to say 5 times fast.
Inevitabilities. Yeah.
There's always a flu season. Well, there's usually more than one flu season. Right. There are always going to be weather-related events that have effect on our our public health emergency preparedness department, on our community wellness department, on our immunizations department. Like one singular public health quote unquote event does not affect just one of our individual net health departments. It actually touches multiple departments, whether it's directly by the actual services and activities that our employees have to do, but then also indirectly because our employees need to be aware of if there is going to be, knock on wood, God forbid, another pandemic-like situation, whether it's virus related or we had there was that Legionella outbreak at what used to be Harvey Hall where we did the vaccine clinic. There's going back to our EPIs. They do surveillance on reportable diseases like botulism, and there are some things that kind of stay under the radar.
We had the case back in 2013 or 14 with Ebola.
The
first Ebola case in the United States happened that turned up at Presbyterian Hospital in Dallas, which is 100 miles away from here. So that everybody in our East Texas area had their antennas way up.
Dallas is not that far from East Texas.
No. Yeah, everybody was pretty scared. I was getting questions about, hey, is it safe to go up to Dallas for the football game this weekend? So, well, you going to be close to Presbyterian Hospital? No. Well, you're good. So there was a lot. But the Ebola caused us to really, okay, if something would happen around here, we had to have conversations with the city and county about if we were to have that situation, what would we do? How would we, is there a place to house people around here? So we talked about that.
So everybody listening, you can multiply that in your head or think exponentially with Ebola. Zika, remember that was?
Yeah, Zika.
We had some Zika cases. Those what 2014, 15, 16?
16, and we had
H1N1.
H1N1 in 2009, I think it was. Because we were doing our renovation project down the street. We had that. It was the flu case. We did vaccinations about that too, and it wasn't as it impacted younger people. Obviously, not as severe as people did die, but not to the levels of COVID-19.
So, point being, everyone, there's always something. You may not always know that there may be something that we're checking on, health department, health district wise. But this is our 24/7, 365. This is what public health does.
Our job.
And I've heard you say this before, maybe not in these specific words, but a statement that I've kept in my head is when public health is working properly, when we're doing our job, the average person doesn't know that we're in existence.
Sometimes we call it the invisible guardian. That's a tag we did several years ago. We said you're public health, you're invisible guardian, because we're out there. And I've also heard it said the public health is like the offensive lineman of your football team, the O-line of your football team, and it's basically we're the ones that are here to protect the quarterbacks and other people. But so our tasks are basically like your O-line, and O-line you typically don't hear about.
Yeah,
unless there's a sack
or an offsides. Or
then they get
illegal procedure.
If there's an infraction,
holding infraction.
The eyes are on
on
number 64 or 73, whatever they call out the number. Like the spotlight is directly on you at that moment. And that's really what public health is like. You don't think about us. It's a broad statement. You don't think about us until something goes wrong. So, a boil water notice is probably a good example. The average citizen may not think about the safety and quality of their water until there's a boil water notice.
Yeah,
who checks that? How they even learn that our water isn't safe in the first place? And what's that whole process and testing? And when's the boil water notice going to get lifted? That's public health in action.
We have our laboratory here at Net Health. They're the ones that are front line of that. I remember during the Great Freeze of 21. There was numerous water systems in the area that failed because it got below zero. Our East Texas infrastructure is not designed to deal with. We're designed to deal with temperatures over 100. We're not designed to deal with temperatures under zero.
So I'm laughing at that statement. For everybody listening, George has 2 children, one of which was married in November.
Correct.
And then your daughter's getting married in March. So the way you said that phrase, the Great Freeze of 21, can't wait until you become a granddad. You can say that to your grandkids.
The great birth of
freeze.
Whatever year.
Yeah, I want to wait until we get to 2040, 2050, and we can start saying that. I mean, that's another community response that we had to go through with our emergency preparedness department.
Oh, yeah. We're in the midst of, we were in the midst of just rolling out the vaccines when we basically had to essentially halt that effort because nobody get around. Mm-hmm. They may have, we want to protect people against COVID, but we also want to protect people from getting hurt in an accident driving on streets with had inch of ice on it. So that was a challenging time.
And then I do know our public health emergency preparedness department, they do not like saying the weather-related event that starts with a letter T or starts with a letter H.
Yeah.
But they had to respond in that way. This was back in 2015 and then 2017, where there were some T's in Van Zandt County and Henderson County. Where I remember it left a 30-mile
it was
stretch of landscape work.
Yeah. Well, then locally here
say.
by June, it was the 3rd of June of this year, we had a major wait.
I forgot about that.
Here in just in Tyler, lots of people had trees down in their houses. I mean, it was lots of electricity out. It was a major event here in June.
Mm-hmm. So, looking ahead to 2025, the majority of the services that are provided by our net health departments, are there any, not necessarily a resolution or resolutions, but are there, what about public health are you looking for? What excites you about 2025?
Well, I think one thing
is
our first, again, it goes back to, I think, what can we do in our world to help encourage the community to get healthier in 2025? We have our Fifth City Tyler Initiative going on. We have our Health and Wellness event, which is going to be Thursday, January 16th from 4 to 7 at the W.T. Berkshire Conference Center here in Tyler. Encourage
it's open to anybody.
Tyler, Smith County, all over East Texas. Come out and learn what can you do to take control of your health in 2025. Because we all have, seem like New Year's resolutions come around, and that's happening pretty shortly here. Everybody always think, well, what can I do to be healthier in the new year? Here's some. Let's give you some ideas and some tools in your toolbox to get healthier in 2025. We also have a challenge there with the carrot, Lighten Up East Texas to lose weigh in January and weigh out at the end of April. To lose weight, lose 5% of your weight. If you weigh in, weigh out, you're eligible for prizes, and our grand prize is a $5,000 cash prize.
So did y'all hear that? $5,000. So you can use that money however you wish.
That's right. Maybe if you lose some weight, help you buy a new wardrobe. Mm-hmm. Help you get some healthy food. Go on a vacation to celebrate. So do whatever you like to do with that. That'll be your money. So that's something that's coming up out there. I know our folks in Takora and her team are doing some things in maternal health to try to look at things we can do in our community to help mothers have a better experience in childbirth, and then help babies grow and be healthier. I think it's going to be fascinating to see some of our other departments, and Vital Stats Environmental Health is looking at some things they've got a new district order for food that's coming up after the first of the year. What are things in that area? What can we do to do a better job working with mobile food units? Our laboratory's growing, our immunizations department. What can we do to basically help our community get immunized against vaccine preventable diseases? So, we don't want our kids to get sick. So what can we do to help with vaccinations there? And then the work that you guys are doing and trying to get the word out about net health. The excitement that we're doing podcasts now. That's an exciting new thing. We're trying to do in different ways to engage the community. So I think there's lots of things on the horizon that are real positive.
Mm-hmm. Yeah, and I think as a whole, I guess the services that are provided, those things don't change, but I guess how it is that we kind of address those things,
right.
Those things become a little bit more nuanced, and how it is we do that. And like you mentioned, we have the new website, so Net Health.
Yes, the new website.
The website has been updated. Hopefully, that will continue to grow and become a tool that is a little bit more effective for the general community to access our services, to be informed about our services. So you'll definitely check that out. The URL hasn't changed. It's still mynethealth.org, www.mynethealth.org, but it has a new facelift, so y'all go check that out.
New and improved.
But yeah, I love how you mentioned that, George, is that the way that we address communities doesn't necessarily, the things that we're doing to address communities doesn't necessarily change. Public health initiatives, what we need to do, like you said, providing vaccinations, public health emergency preparedness, but how we engage the community to get to our services may change a little
right.
bit. New programs that come about to address some of these health
So
concerns.
what do we mean? We have a bevy of programs and services. What can we do to I think our challenge in the days to come is going to be how can we best engage our communities to where they will hear the messages we're trying to come out, and then if they need help, engage with us, ask our help to do that.
We couldn't plan that, y'all, having the sirens in the
No.
background. That's the public call for public health,
Yeah, there you
George.
That's it.
I was waiting for the siren to go away.
It's not going to last for a while, isn't it?
No, let's making sure we had have hit each topic that we had on the outline. So we touched a bit on the future of 2025 and beyond, of a few strategic priorities and goals for 2025. There's, I think the CDC puts out Healthy People 2030. Is it CDC that does that?
I'm not sure what group. I remember Healthy People 30, yeah.
But so where I'm transitioning with this, where if there was a Net Health 2030, so 5 years from now, where does Net Health CEO George Roberts envision the community health, the population health of East Texas?
Sure.
5 years from now, like where would you like to see East Texas, and how can we make those steps to get to that 5 year
well, I think
goal?
one of the things I'd like to see, Tyler Smith County, but also East Texas, is to get healthier. We're studies that were done by UT Tyler. There's been 2 different studies that shows that we're one of the. If Northeast Texas were its own state, we'd be one of the most least healthy areas of the country.
And that goes into quality of life.
Quality of life goes into cardiovascular disease, cancer rates, lots of things. And so I'd like, crystal ball, we know our hopes and dreams are, instead of being one of the least healthy areas, we become one of the most healthy areas. Our cardiovascular disease rates go down, our cancer rates go down, our quality of life, people happy, generally happy. What are things that we can do to help with that? We've got our organization, but we have a new med school that's here now. We're into year 2 of the med school. We have a preventive medicine residency now that's going on that's very positive. We're seeing growth. The access to healthcare, I think, will really get better over time. That's been one of the things that's been a real challenge in our area, is basically people don't have access to a physician or a nurse or mid-level provider. So having better access can hopefully keep people healthier, and we can help people that they stay healthier, number one, but also if they do, they're getting screened enough to where they can, if there is something going on with them, they can find potential cancer or a problem earlier versus later.
So I want to pinpoint where the term health, to everybody listening, this is more than just your body weight. This is more than just losing a few pounds or getting to whether you're wanting to lose weight or whether you're wanting to gain muscle. This is not just your physical body. This even goes into your mental health status, your emotional well-being, your financial health, your emotional health, the Maslow's hierarchy of needs, of making sure you take care of just those basic day-to-day necessities of having dependable shelter. You got a place to live. You've dependable access to food. Food insecurity is another major issue here in East Texas. Of what you mentioned before, having access, just basic access to food, period. Regardless of the quality of that food, just you know where your next meal is coming from.
Right.
For some people, not everybody can answer that question on a day-to-day basis. So there are different levels to staying healthy. My comment, adding on to what George just mentioned, is that you should find what level of staying healthy, which level you personally should focus on becoming more stable or more sustainable, or getting a better, firmer handle on if it is access to food, or if it's access to dental care, or if it's dental care, if it's getting on a health insurance plan, if it's seeing a doctor regularly, if it's getting more sleep, if it's whatever one singular thing that you can do that's going to have a major impact on you staying healthy, focus on that one thing first. You get that one thing down, then you can start working on the next thing. You get that next thing down, then you can work on the next thing. So instead of thinking of the totality of how to make yourself healthier, think of one step, just one small action that you can do, whether it takes a day or if it takes a week or if it takes a month. Like break down your overall goal of becoming healthy or staying healthy, but break it down into manageable pieces. Because if you can do that step by step process, you'll be more successful because you're able to maintain all those changes that you're planning to make over time.
That goes back to our Fit City moniker. Basically, is the mission of Fit City is to make Tyler a Fit City one step, one bite, one health conscious decision
at a time.
At a time.
Yeah, not all together.
Yeah, because I think that's what I think that's what happens to people is that I need to fix 1, 2, 3, 4, 5, and where do I start? And the whole thing is the old thing about how do you eat an elephant, Thomas? How do you eat an elephant? One bite at a time. You can't. The elephant's too big. If you got 5 or 10 issues you need to address, okay, well, what's one thing I can do today? Mm-hmm. And then maybe I need to do something tomorrow. But you got to, instead of getting frozen on
paralysis by analysis.
Yeah. What's my top 10? Well, why don't you let's pick one.
Yeah.
Let's just do something. Do something. Take one step. And you're not solving all your issues at one time, but let's take care of one bite at a time.
Yeah. A lot of people don't even start because they just
they're frozen.
They get frozen up by it seems like a task that is too big of a challenge to overcome. It's just like, why start at all? Why make any changes? Yeah, you're right.
Still think about, what's one thing you can do? What's one thing you can do today to basically, what's my first task I can take care of today? Make my bed.
Yeah, for sure.
There's a book written about make your bed. So let's start one task. Okay, I've made my bed. Now what's the next thing I do? Okay, I can take a shower. So maybe I can go for a walk. And I don't have to go. I'm not trying to go for a 10-mile walk today. Maybe I can just walk around the block.
Yeah.
So as I talk to you guys today, I'm still got a walking boot here for a little bit longer. So it's at least, but I can walk around the block. I can't run right now, but I can walk.
One step at a time.
One step at a time. One step takes a little bit longer than it did for a couple weeks ago, but hey, one step at a time. In closing, guys, I think that I think it's important. One thing I've heard, and I think I took this from somebody else came up with this quote, is that since 1900, 30 years have been added to the average lifespan of Americans. 25 of those are due to public health initiatives. We think about all the great medical care advances we have, but let's just think 30 years of life have been added to the average lifespan of Americans since 1900. 25 of those are public health initiatives. Like, what? What is that? Well, think about it. What are the things you take for granted? Clean water. When you opened the spigot this morning to get a drink of water, did you worry that the water was clean? I didn't.
Or taking the shower.
Yeah, taking a shower. Safe food. Safe food. Restaurants are being inspected. There's health standards out there. People, obviously we're not in every restaurant every day, but restaurants, they know, wash your hands, all that kind of stuff. So clean water, safe food, then vaccinations. One of the greatest public health achievements ever has been the polio vaccine. Think about when I first started in healthcare, we had iron lungs in the hospital that we would have to have, for polio patients. And hospitals don't have that anymore because
it's not a need.
Don't have because polio is just about been eliminated around the world. But it was a childhood disease, which I think about my parents that for my generation that they worried about their kid getting polio because they couldn't do anything about it. So we got somebody. So that's a great a great achievement in the world right now is vaccinations.
So, as we close, is there a message that you would like to leave with our listeners, either about our organization, the Northeast Texas Public Health District, or the overall importance of public health? And you kind of touched on that with what you just mentioned, but so everybody listening, George has this element where he likes to call everybody young or younger. Like I'm young Terrence, young Thomas. So speaking to young East Texas,
yeah.
I think for the younger ones that are coming up and thinking about a possible career in public health after they graduate high school or graduate college, like as a well-established, tenured leader in hospital administration / public health administration, are there a couple of nuggets that you could share with the
sure.
future?
So what's in terms of a message for the public, as I said earlier, that what's a neat feeling for me is to go out and see our employees who are passionate about serving their community, whether it be in helping people get their birth and death records, whether it's making sure the restaurants are doing what they need to do to serve safe food to the public, whether it's our lab that's basically making sure that milk is safe to drink and that water is safe to drink, whether it's our immunization staff that making sure that people get immunized, whether it's you guys here in this department making sure that communicate that public health is the message is received, our preparedness department making sure that we count the cases out there of diseases and our communities are ready to go. Whether it's our TB nurse that's out there every day, whether it's our WIC staff that's in 20 counties helping pregnant mothers and children eat properly so they can basically be productive individuals in society. So I think that's what, if you're looking for a field that basically you can serve your fellow man and fellow woman and try to make an impact, positive impact on people's lives day in and day out, public health is a worthy profession for you to consider. And that's what, again, we're here for the public as well. We're here, public health, Northeast Texas Public Health District, one moniker I have, it only impacts one aspect of the population. We do something for everybody in this community every single day.
Yeah, because you said how we're not medical care, or we're not seeing one patient at a time. It's not one person at a time. It's
the entire population.
Hundreds, thousands at a time.
So all of our collective jobs, all three of us in this room, our job is to help make sure that our community is healthy and that we can all live productive lives. And if we have a healthy community, what does that do? Basically, business is able to function. If we don't have healthy citizens, businesses can't operate because you got to have employees to have businesses operate. A healthy community denotes healthy employees, denotes healthy businesses.
To keep our city healthy, to keep our community healthy, and keep East Texas healthy. It's hard to. You really can't do that much when you're not healthy.
That's right.
I was trying to find a way to summarize.
That's right. So you
just feel better when you're healthy.
And the mission, I talked about the mission of Fit City Tyler, but our mission of the Northeast Texas Public Health District: prevent illness, promote health, protect our community. Prevent, promote, protect. So that's what we're here to do every day.
So, on behalf of everybody listening, I want to thank you, George, for the last 18 years and for the next 18 years.
Absolutely.
Or however long God's going to bless all of us to be,
working
to be in the position that we're in right now.
That's right. How long we all get to work as long as we get to work. So,
yeah, work is a privilege. It's not a begrudging.
Yeah, and I think that's something to tell people that I don't say enough. It is a privilege to get to serve in this role. I mean, I think it's been, I don't take the role lightly, but also think I don't say it enough. It really is, for me personally, it's a privilege to get to serve in this role. It's a privilege to serve, and I think that's where, really, I say our employees. They may not say it every day, but I think they all recognize that it is a privilege to be able to serve. Because when you're able to help somebody, just think about when you're able to help somebody. When somebody comes up to you and says, "Thank you for helping me," it's like that's one of the greatest compliments you can get.
And it doesn't really resonate in the moment. You have to have a servant's heart.
Yes.
To work in public health. Whether it may be explicitly said to our current employees and even to future employees in public health departments, wherever you may be, you have to love, like you said, you have to have that passion. You have to love doing what you do in public health. So I think this is a good wrap up for our first season of Casting the Net. For those of you listening, if you had any questions that popped to your mind that you'd like to ask to Net Health CEO George Roberts, you can send us an email to our email address. It's castingthenet@netphd.org. That email will be in our show notes. You can go to our website, as Thomas mentioned, mindnethealth.org. You can go to our contact page. You can shoot us an email that way. You can look us up on social media. We have the Instagram and Facebook account. Our main office location is at 815 North Broadway Avenue in Tyler, the corner of North Broadway and Gentry Parkway. All that's to say, we're not hard to find. We're not invisible. We're not an invisible guardian anymore.
That's right.
We're a present visible guardian, and we look forward to our season 2, which will be debuting early 2025, where we want to continue to giving you more glimpses, more perspective of the variety of services that NetHealth provides, because we could keep talking with George for 2 more hours and we wouldn't cover everything. No, we've said this for
I can
every
tell you more history too. So.
For every department, there's we're only touching the surface of what each department truly does on a daily, weekly, monthly, yearly basis. So we thank everybody for listening to this episode of Casting the Net, and we look forward to speaking with you more in 2025.
George, we appreciate you coming on.
Oh, thank you. Well, thank you for having me, and thank you for making this my first podcast such a positive experience.
Yeah. And we thank you for your service.
Thank you.
And we'll definitely have to see about having you back.
Thank you.